For our last speaker, let me introduce to you Beth Helmold. Beth recently joined BCDI after working for a few years as a liaison for our comprehensive care clinics. People loved the information that Beth was giving, and we thought it's a no-brainer to have her here full-time to be in all of our comprehensive care clinics, especially for people who have been asking about that kind of support for a long time. So we're so happy to have Beth as part of the BCDI team, and she's going to talk to us about how a dietitian can help with your care. So Beth, take it away. This forward and backward, and the pointer doesn't work.
Okay. Okay, thank you. Like Dr. Tarantino said, my name is Beth Helmold, and if I haven't met you already at a comprehensive care clinic, Family Day is perfect timing because I can introduce myself and also my role here and how I can help you or your family member or your child. So here's a quick quote that I like because it includes everybody. It says, take care of your body. It's the only place you have to live. So obviously we only have one body for our entire lives. And even if you're not interested in nutrition, it still applies to you. Most of us eat every day. And so whether or not you've had an invested interest, it's something that still affects your health, affects your body, affects your life. So a couple topics that I'll talk more about are how does nutrition relate to bleeding and clotting disorders? Why does BCDI now offer expanded nutrition services? Is wellness more than just weight loss? How can a dietitian help you? And how can a dietitian help your child? So first of all, here's a couple of the common correlations that people may make between nutrition and bleeding and clotting disorders. So depending on what disorder you're familiar with, some of these might already be familiar to you. So a few examples, it definitely isn't everything. Somebody with anemia may have an iron supplement, but also the foods they eat affects the amount of iron in their blood. When taking a supplement, there's certain foods that can help that supplement be more effective, and there's some foods that can actually make it less effective. So that's an area of education we provide to our patients on iron supplements. Vitamin K and blood thinning medications is another common area. If you're on a blood thinning medication, we try to educate our patients about how that can interfere with foods that are high in vitamin K. Talking a little bit about children, hemophilia in children actually puts them at twice the risk for overweight and obesity than the general population. So as if they're not already facing other challenges, that's already increasing the risk that they are going to become overweight or obese during their lifetime. For adult hemophilia patients, having increased weight increases the pressure on joints and muscles, and that can cause more joint bleeds. That affects physical activity and pain. And then healthful eating does not cure a bleeding disorder, but having the right diet can help prevent other health conditions from developing. So heart disease, type 2 diabetes, hypertension. We want to prevent other health conditions from occurring. So why did BCDI find it valuable to start offering nutrition services? So like Dr. Tarantino said at the beginning, we have a treatment model for comprehensive care. So we want to treat the whole patient, not just look at your labs and prescribe medications and send you out the door. So we already have other specialists that have been working here. You might have seen our dentist, physical therapist, social worker, our allergist. And so having me come on board is another part of the team. And that way we can all collaborate together. So you might have a dentist outside of BCDI, which is wonderful, but having us all in-house here to treat our patients together allows us to form treatment plans that can be most effective and help you to control your disorder. So nutrition is also a part of wellness. And so that works hand in hand with healthy habits. So we are in the process of developing a wellness program for our patients at BCDI. And how that's going to be beneficial is it's going to give you support and accountability for patients that want to improve their physical activity, maybe improve their weight, eat more healthfully. So instead of just seeing myself or other specialists one time a year, we can stay in touch more consistently and we can give that accountability and support. So is wellness more than just weight loss? Dietitians are often associated as like a weight loss coach. So like I said, we are starting a wellness program here, not a weight loss program. So weight is just one measurement. Somebody could be a healthy weight. That doesn't mean that they are a healthy person. We also want to look at your vital signs. We want to look at your blood work. There's a lot of things that go into your health and being well. And healthy eating is only one piece of that. So wellness also encompasses your physical activity, maybe quitting smoking, getting better sleep, decreasing your stress. Eating is just one piece of that. So improving your diet can help improve your health through prevention. So maybe a patient's at a healthy weight already. That doesn't mean that it wouldn't be beneficial to talk about your diet, because we can make a plan to prevent weight gain over time. It's very common as people get older to put on unwanted pounds, and over the years it can add up. So even if someone's at a healthy weight, it can still be beneficial to make a plan to stay at a healthy weight. If you're underweight, it's a less common problem than overweight, but it's still a problem. So having someone gain weight to reach a healthy weight also promotes optimal health. Okay, so if I were to see you or your family member, how can I help you? And I already is a registered dietitian, by the way. I can work with you by discussing any health conditions that might be affecting your diet. People might struggle with severe acid reflux or food allergies or other conditions, maybe diabetes, that affect what they eat and what they're supposed to eat. We can review the timing of medications and potential nutritional side effects. You might have severe nausea from a medication. You may need to take it with food or in between meals. So I can help you map out what that structure might look like for your eating. If weight management is something that you need to work towards, I like to make individual plans with people. So that means not fad diets and not drastic life changes. My approach is typically to talk about your typical day, your lifestyle, and how can we find a few areas to make feasible changes for long-term success. What you don't want to do is make drastic changes that you can't sustain long-term. That usually gives you quick success, and that usually leads to a rebound of weight gain and you're back where you started. So assessing eating habits and providing guidance on the healthfulness of your diet, you might be a healthy weight, you might be in good health, but we might identify places where you have some gaps in your diet. Vitamin D deficiency is something we're becoming more aware of now. So maybe we notice that you don't have some good sources of vitamin D in your diet. You might need to talk about foods to add, or the last point is whether or not it might benefit you to take a supplement. We can talk about nutritional supplements that you might need, but also nutritional supplements you might not need. Definitely don't want to add more medications, and some people think more is better, and maybe they're buying a lot of things that they see on commercials or at the store. So we can talk about what's actually necessary for your health needs. So given the different topics I just talked about, how would a dietitian help a child? Well, if you have a child or you're familiar with children, you know that they don't typically do what we want them to do. They do what they want to do. And sometimes that can lead to picky eating. It's a very common problem. Well, we know that healthful, well-balanced eating is what's beneficial for bleeding and clotting disorders. So we can help navigate some of those pitfalls. We can discuss the relationship between certain medical conditions and how those affect nutrition and growth. So for instance, a child with multiple food allergies or a child with autism may have a limited diet, or they may have a limited acceptance of foods. So talking about how we can maximize them getting the proper nutrition to grow appropriately. Reviewing growth charts is something that I like to do with parents. It not only gives you an idea of how your child is gaining weight and growing for their age, but how proportionally they're growing. So that's something I like to pull up. And sometimes it can reassure parents if they're worried about their child's growth. And sometimes it can identify some problems. Maybe they're getting behind. What can we do to intervene? Similar to adults, we can discuss the need for an infant or a pediatric nutritional supplement, whether that be a daily multivitamin, or some kids benefit from nutritional drinks, such as like Pediasure. Sometimes that's something we need to add to make sure they're growing properly, getting all the nutrition that they need. And then just establishing lifelong healthy habits. So whether I would be seeing your child or your teenager or you as an adult, just making sure that we are focusing on wellness and establishing those habits along the way. So I look forward to working with you and your family and hopefully get a chance to meet you if we haven't got to meet yet.